How do the body's repair mechanisms fail in pathology? Imagine your body as a well-oiled machine that can fix itself when something goes wrong. But sometimes, this repair system hits a snag, and things don't heal as they should. That's what we're here to figure out today. When you get injured, your body kicks off a repair process. It starts with inflammation to clear out debris and fight off germs. Then, new cells grow to replace what was lost. Finally, the tissue remodels itself to regain strength and function. All these steps need to happen in perfect harmony. But what happens when this process doesn't work? Sometimes, the repair gets stuck in a cycle, leading to chronic wounds or excessive scarring. Other times, it just stops altogether, leaving wounds open or tissues weak. The reasons for this failure are many and involve both cells and molecules. For example, inflammation is necessary, but if it lasts too long, it can damage tissue and slow healing. In people with diabetes, high blood sugar causes ongoing inflammation, making it harder for immune cells to do their job and for wounds to close. On the flip side, if inflammation is too weak or short-lived, bacteria and dead tissue aren't cleared out properly, which also delays healing. Cell migration and proliferation are key for covering a wound with new skin. Cells called keratinocytes need to detach, move across the wound, and multiply. This process depends on molecules like integrins, which help cells stick and move, and growth factors such as epidermal growth factor, fibroblast growth factor, and hepatocyte growth factor. When these signals are missing or faulty, healing slows down. For instance, animals lacking certain integrins or growth factor receptors take longer to heal because their cells can't migrate or multiply effectively. The extracellular matrix is like the scaffolding that supports new tissue. Enzymes called matrix metalloproteinases help remodel this scaffold during healing. If these enzymes are overactive, they break down new tissue too quickly. If they're underactive, the tissue can't be properly organized, and healing stalls. Cells can also become senescent, meaning they stop dividing and start secreting inflammatory signals. In chronic wounds, these senescent cells hinder new blood vessel formation and promote fibrosis, which is excessive scar tissue. Certain diseases make repair even harder. In vascular diseases like peripheral artery disease, blood flow is limited, so tissues don't get enough oxygen and nutrients. Chronic inflammation from autoimmune diseases or infections can also interfere with healing. Aging is another factor. Older people tend to have slower cell growth, weaker immune responses, and more cellular damage, all of which slow down repair. Some genetic disorders affect the genes involved in cell adhesion, growth factor signaling, or DNA repair, leading to severe healing problems. In medical school, understanding these failure points helps future doctors recognize why some wounds won't heal and how to treat them. For example, controlling blood sugar levels in diabetics, improving blood flow in vascular diseases, or applying growth factors directly to wounds are all strategies based on these repair mechanisms. When looking at tissue under a microscope, pathologists look for signs like persistent inflammation, excess scar tissue, or lack of new epithelial coverage to identify where the repair process went wrong. So, in essence, the body's repair system can fail at many levels. Whether it's too much or too little inflammation, problems with cell movement and growth, or issues with tissue scaffolding, these failures can lead to chronic wounds or abnormal scarring. Recognizing these failures is key to diagnosing and managing healing problems effectively.